9:15 on the dot this morning. You know, we're entering a really difficult period in the pandemic. We actually told you a few minutes ago that cases are skyrocketing. At the same time, there are signs of hope. A vaccine could be weeks away. And to help us understand all of this, we will bring in our medical expert and our friend, Dr. Arnold Baskies. He's the past chairman of the National Board of Directors of the American Cancer Society and also chair of the Global Cancer Control Advisory Council. Dr. B, thank you for joining us this morning.
Good morning, Stephanie.
So we've heard these warnings over and over again. Officials telling us to celebrate Thanksgiving with only the people who currently live under our roof. But we've seen the lines at airports, right? People are deciding to travel. And if you do decide to welcome people from outside your immediate household, what can you do to protect yourself and your loved ones?
Well, Stephanie, just as you said, the number of cases of COVID-19 are surging again across the whole country, which coincides, by the way, with colder temperatures and lack of humidity. The safest way to celebrate the holiday is to celebrate at home with people you live with, but recognizing that realistically, people are not going to adhere to that best advice. If you do have to travel, the planning is critical to reduce the chances of bringing the coronavirus with you. So, number one, before you leave, get a PCR test as close as possible to the travel date and quarantine for as close to 14 days as possible. Number two, drive alone if you can. A solo road trip or driving with people you know who are low risk is theoretically the best way to proceed. Number three, travel at non-peak times. Number four, regardless of how you travel, be sure that you follow public health recommendations, which means mask wearing, hand hygiene, and social distancing whenever possible, especially and if you get out of the car. Number five, keep your guest list small when you get to where you're going. And this is not the year to celebrate with the oldest and possibly least healthy people in the family. Number six, arrange an outdoor meal if possible. Even when you are outdoors, the attendees should be at least 6 feet apart, and guests should keep their masks on when they're not eating or drinking. If there are multiple households that are attending, seat them separately at really well-distanced tables, and forget about the closed tents. That makes absolutely no sense. If you can't do the dining outdoors, do whatever you can to improve the ventilation, maintain the distance, and wear a mask until you eat or drink indoors.
Now, I have to follow up with you on a question there. You talked about PCR testing, and it's always best to take that test a few days before you leave. But when you come back, what should the timeline for that be? What's some advice that you can give us so that you don't come back and spread it to more people at home?
Right. Again, what you want to do is you really want to avoid traveling if you can. But we recognize, everyone recognizes that isn't what's going to happen. So yes, when you get back to where you were enjoying the holiday, get a PCR test done and get it done as soon as you get back, and try to quarantine at least for a week or two, when you get back, unless you have a negative PCR test.
Okay. So here's the other thing that we want to talk to you about. This week, Pfizer submitted its vaccine to the FDA for emergency use authorization. So if that's approved, it's expected that the first people to get the vaccine, of course, are going to be healthcare workers, vulnerable Americans like the elderly and those with underlying health conditions. We've gone over this. Now, here's the thing, though. Once those high-risk groups are protected, do you expect that that would lead to a drop in hospitalizations? And if so, is there a chance that that could then lead to an easing of restrictions even before most of us are vaccinated? Because, you know, the reason that we're having all of these restrictions is to not overwhelm the hospitals. These hospitals are being overwhelmed with people who are otherwise vulnerable. So if they're protected, could we see a big change here?
Well, isn't it good news that we have 2 vaccines that are about to be released? The doses, by the way, are being shipped by the millions on dry ice. The #1 provider of dry ice for shipping vaccines is Acme Ice, located in Cambridge, Massachusetts, and they have been supplying over 40,000 pounds of dry ice a day for months. That's the best indication that vaccines in the millions are being delivered and stored at various strategic locations around the country. Once the folks who are most at risk and the treaters are vaccinated, That hopefully will translate to a mild improvement in case numbers. But remember, the worst months for exposure will be the next 3 to 4 months. Given the temperatures and the holiday gatherings that we expect, the number of people infected will continue to rise to record numbers until the weather gets warmer and the general population receives their vaccines, which will take some time. Unfortunately, the news will continue to show huge rises in numbers of cases for the next 90 to 120 days. However, the mortality rate has been dropping, which I hope will continue to be the case. But to answer your question very specifically, because of the low numbers of people that are going to be vaccinated at first, we probably are not going to see a major change in the number of cases that are being reported. And that's the unfortunate part. But it won't be long before the general population begins their vaccination process and the temperature gets warmer. Right. So we have to get through these next 3 to 4 months. That's critical and key to trying to keep this thing under some kind of control.
All right, Dr. B, we'll have to leave it right there. Thank you so much for joining us again and sharing your insights with us. We appreciate it.
Thank you, Stephanie, and go Eagles.
There you go. All right.